I guess I can tell you that officially we don't have a confirmed case. We did have a brainstorming discussion this morning. You also have to understand that Quintana Roo, which is our neighbor up north, doesn't have cases. And I believe the Petén area in Guatemala hasn't reported any cases. So if you are looking at it in that geographic area, then consider that as a bigger country, then perhaps I would say no.
Officially, there are no confirmed cases of Zika in Belize, but it's just a matter of when the country will document its first case of the virus. That was the message coming out of the Ministry of Health following a Zika national sensitization meeting with regional managers and health personnel from across the country.
We have started sending samples to CARFA. We have so far sent 3 samples to Trinidad and Tobago. We have gotten 1 result back. That result was negative for dengue, negative for chikungunya, and negative for Zika. So we still have no confirmed cases in Belize. We are waiting for those other 2 results, which I expect should be here by Friday.
The 3 samples sent to the Caribbean Public Health Agency were taken from persons from San Pedro and Las Flores Cayo. Director of Health Services, Dr. Marvin Manzanero, says that the symptoms are similar but milder to that of dengue and chikungunya.
There's no particular measure that you can do at a border entry point because you can be asymptomatic. 80% of Zika cases will have not a sign or symptom. And because they are very unspecific signs and symptoms, you could be having the flu would you be screened and be sent for Zika testing? It's not normally recommended. I don't think any country in the region is testing for Zika. And you also, when you cross the border, you could be asymptomatic, which means you got bitten, are not showing any sign or symptom as yet, and you're coming into the country. What we are doing though is if the patient shows up at a health facility, your travel history will be recorded. And if you have a positive travel history of having been in an area where Zika has been documented, then that triggers a potential Zika case that would require testing.
Today, at the conference room of the Inspiration Center in Belize City, Ministry of Health officials discussed a national preparedness plan of action, while the Public Health Department will work with local municipalities and stakeholders with information and prevention tips. Residents must follow best health practices.
Because you're dealing with the same vector for dengue, chikungunya, and now potentially Zika, what we are asking them is to look at the data that they have in terms of known hotspots, known high-risk areas, where we know that there are certain indicators that tell us that these are hotspots for transmission of whatever diseases the Aedes aegypti or Aedes albopictus mosquito causes. And so we're basically highlighting in the national preparedness response and preparedness plan for them to go back and look at their data. They already know the little hotspots within their district.
The Center for Disease Prevention and Control, CDC, recently released a report that Zika can be transmitted sexually. That first case was documented approximately 2 years ago, and there's also the issue of microcephaly, where in Brazil, babies being born with smaller heads are linked to the virus.
Persons traveling to communities with active Zika virus transmission, especially men, well, when they come back to country, they should be utilizing a condom for at least 28 days. If the person traveled to a community with active transmission of Zika virus and confirmed to have an infection by Zika virus, then the recommendation is to utilize a condom for 6 months. That is what is documented and recommended so far by the World Health Organization.
Wayne Moody for News 5.